Good afternoon and welcome to the latest in our series of live employer webinars aimed at students in Hertfordshire and the surrounding areas to help keep you informed about what your next decisions might be in terms of your career. This webinar and all the other webinars we've done are brought to you by the Hertfordshire Opportunities portal. That is www.hopinto. If you look at the bottom of my screen there, you'll see that Hop Into. It's a website we very much encourage all young people and schools to be using across Hertfordshire. It contains lots of very, very useful information about the sorts of employment sectors that are important and significant to us in the county. You can also have a look at any live vacancies that are coming up as well at the moment, as well as giving you access to a whole host of other information about a variety of different careers that are available to you. Today, our focus is going to be on nursing, which is not only very, very important in Hertfordshire, but it's very important across the whole of the country. Across the UK, there are over 660,000 nurses registered. And all the predictions are that this is only an industry that's going to be growing. And there's a projection that within Hertfordshire alone, we'll need 10% more nurses than we've currently got within the next 7 years. We've got a very exciting panel with you today who can talk to you about their own particular routes into nursing and their own particular roles. We've got Jackie Vincent, who is the Deputy Director of Nursing and Quality in Hertfordshire. There is another part to her title, and I'm going to ask her to explain that to you in a little while. And we've got Gemma Bush as well, who is a mental health nurse. But she's got a very interesting story she'll go on to tell you. She actually started her training as a midwife, and I know that quite a few of you that are watching today have cited that as a particular area that you're interested in finding out about. We're also hoping that Jo Prytherch will be joining us today. Jo is the lead nurse for workforce and education based out in the west of the county, so in sort of Watford, Hemel, St Albans area as well, and hopefully she'll be able to come on as well for us today. Before I allow Jackie and Gemma to introduce themselves, though, just a couple of bits of housekeeping for you, just to reassure you that all of you watching at the moment, we can't see you and we can't hear you. You're completely invisible to us, but we do know that you're out there. Hopefully you can see and can hear us. If you can't see us, then hopefully you can at least hear us. This is a live recording. We will record it and it will become available on our HOP platform probably later today or tomorrow morning. So if there's anything that you've missed and you want to watch back again, it will be available for you. And if you know of any family or friends that you think might be interested to watch this as well, then they will be able to watch that and play that back as well. But you all have an advantage because you're watching this live. You have the opportunity to interact with Jackie and with Gemma and to ask them questions, because I know that you're all going to be really intrigued by lots of things that they say to you today. But it's really important that you interact. So there's two ways of interacting. So the first way will be over a poll that we will put up on your screen. That will be towards the end of the session, and it'd be really good to get your feedback on how you found the session today. But the other way, and you can start doing this straight away if you want to, is to ask some questions of Jackie and Gemma. Questions that you ask, you do that on your dashboard, which you should have in front of you on your screen. You'll see that there is a questions tab on there. So if you click on that, it will bring it out, and then you can type in there any questions that you've got. That will come to me, so it'll only be visible to me. It won't be visible to the rest of the audience. And then I will pass those questions on to both Jackie or to Gemma. If you want to ask either of them a question specifically, then just make it clear in the question who you want to ask that question to. And I can see one's come in already, which is fantastic. And we will try and answer all of those questions. So thank you. Glad to know that the technology is working. As I said, the video will be available later, and we'll give you a QR code with you so that you can tap that in, and then you'll be able to access that. So I'm going to hand over. So Gemma, to start with, can you talk us through your career in nursing, please, including what you're doing at the moment?
Okay, so basically I finished my A-levels and I decided to do a degree in psychology and English. And I completed that degree and I loved it, but I didn't know what I wanted to do after at all. I was still a little bit in kind of a limbo. And I started to talk to people about what they were doing, and I decided to just go and get a bit of experience. And because I was that little bit older, I was able to go and start work as an HCA in an adolescent psychiatric unit. in Hertfordshire. And I loved it. During that time, I'd also started to apply to be a midwife. So I had interviews at various universities, and I got into be a midwife. But during the course of gaining my experience, I decided that actually I really loved the psychiatric nursing, the mental health nursing. So I decided to change track. And so I asked the universities if I could please change from midwifery to mental health nursing, which was no problem. So I began my course, loved it, but every single placement I had, I was always really interested in young people and families. So I decided to sort of specialise all my placements that I could choose. I decided to specialise them all in those areas, just so that I could get as much experience as possible. And I just really enjoyed my studies, and I actually did a lot better in my nursing degree than I did in my other degree, and I think a large part of that was because I loved it. When I qualified, I decided to go and work in an adolescent psychiatric but eating disorder unit, private unit in North London. That was for young people, and I enjoyed it, but I missed part of the NHS working. And so I decided to get a new job at Great Ormond Street Hospital for the hospital for sick children. They have one mental health ward, and that ward specialises in eating disorders and disorders where people display symptoms as physical symptoms, but they're psychologically based, medically unexplained. So lots of really intricate family dynamics, lots of really challenging cases, but really enjoyable cases, and I loved it there. I was there for 8 years and really loved every moment of it. And then after I had my children, I decided I needed to be a little bit closer to home, but also I kind of wanted a new challenge. So I decided to apply to be a practice educator in Hertfordshire. And that's just another facet of nursing that you can do. You can decide to help train and support newly qualified nurses, student nurses, returning nurses to practice through this job. And so I've only been here about a month, but I'm really enjoying it so far. And it's all a bit virtual at the moment, so I'm kind of used to this way of working. But I really can't wait to get back out and be face to face with people, because that's the bit that I really do like doing. And that's me.
Thank you, Gemma. That's a really sort of fascinating story, and how you've gone through different strands on there. So the questions are coming in already, but before I start answering those, I'm going to ask Jackie just to explain your role at the moment, Jackie, and then your background and how you got to where you are now.
Robin, thank you, Gareth. So my role, as you said, I'm Deputy Director of Nursing and Quality. So in other languages, that's Deputy Chief Nurse, and that's with Hearts Partnership Foundation Trust. So we're a mental health and learning disability trust covering 4 counties, and not just Hertfordshire. The other part of my title is I'm the Director for Infection Prevention and Control. And that's not normally a busy part of my role, but in the COVID and the pandemic, it's been an extremely busy part. So I'm responsible for infection prevention and control across the trust as well. As you've often find with more senior nursing, so I'm responsible for all the nursing in our workforce, of which we have about 1,500. Hello, Joe. Yes. And that's healthcare assistants, and that's registered nursing associates and our registered nurses. And I also have a number of other services I'm responsible for as well, which is the quality part. But I'm focusing on nursing today. And I started my career a few years younger before Gemma, and I apologise for the background noise. I'm here at head office. We have to be in a large space for reasons of COVID, so my apologies for the hive of noise in the background. I started my training, like Gemma, I did my A-levels and then had a year off, wanted to earn a bit of money and do a bit of travelling, and then I was going to go off to uni to be a teacher with music. And that was always my passion. And I then fell upon some voluntary work with people with learning disabilities. In those days, when I trained in 1990, it was mental handicap. And we had institutions, we were closing down then, and I did some voluntary work at an institution in Watford, or Abbots Langley, one of 6 institutions we had in Hertfordshire, and fell in love with it. And that's how I fell into nursing. And often you'll find, I mean, this might evolve during our conversation, a lot of people fall into nursing more than sometimes make a deliberate, I want to be a nurse. There's a bit of a mixture, but I do find that a lot with my colleagues and those with whom I work. And so I trained to be a registered nurse in learning disabilities. When I qualified, it was RNMH, which was mental handicap, then changes came. And since then, I started after that when I qualified working in the private and voluntary sector, and we'll be touching later about where else nurses can work outside of the NHS, and that was one of them, before then falling back into the NHS, excuse me, and working up the different ranks really, as being a staff nurse, a charge nurse, ward sister, a matron, a lead nurse, a nurse consultant, and head of nursing, and just loved every bit in community and in inpatients, in mental health and in learning disabilities. And here I am today. Like Gemma, my passion stays with nursing. I started my training 30 years ago next month. I'm a Florence Nightingale alumni. I have an honorary fellowship with Hertfordshire University, so I still teach. But actually, what I really feel most privileged and proud is when I'm having service user or patient contact. And that still grounds me and reminds me why I went into nursing in the first place. So my job now is responsible for all the nursing workforce, the students, the qualified nurses, to encourage more like we are today, but also with all the quality aspects and ensuring that our service users receive the best quality care that they should expect, as well as infection control, which has taken over the last few months with COVID. So that's me in a nutshell.
No, I can imagine. Thank you, Jackie. And Joe, we're just onto the introductions here. So if you could just give everybody a bit of an explanation about your role at the moment, and then just briefly your background in nursing.
Okay, I'm working at West Herts and I'm the lead nurse for workforce and education. So it encompasses probably lots of everything that Jackie's already alluded to in ensuring that we've got sufficient staff for our clinical areas, that we review those staffing levels on a biannual basis, but also on a daily basis now more that we've gone into COVID. And also then that we've got a workforce to staff those clinical areas. So that's where my role especially and passion is around education and developing our workforce to ensure that we've got a workforce that's not only able to do the roles, but also then that they're continuously developed so that they can continue their careers in whatever their aspirations are within the nursing scope. My background, I know I don't look this, but I'm over 30 years in nursing, okay. I started having left school in Ireland and then came over and I worked as a healthcare support worker, which would be the equivalent to a band 2 now here in the organisations. In my day, they were known as nursing auxiliaries. And I have worked my way up into doing nursing, midwifery and health visiting. I'm also then, as a mature student, did my degree in combined studies, which was psychology and sociology. And I went on to do my master's in leadership. And then thereafter, because I got into education, I developed and went on to do my teaching qualification. And more recently now I'm working with the Chief Nursing Officers Fellowship in doing a PG diploma around workforce.
Okay, so what this is saying, between the three of you, you've got an extensive knowledge of nursing through your own personal experiences. Not only are you going to be able to reflect on your own personal experiences, but I think all three of you now in the positions you're in will be able to talk about some of the sorts of skills and qualities and some of the things that you are looking for that next generation of nurses who are coming through, hopefully, some of which are on the line with us today. So to set a little bit more context, then we're going to dive straight into the questions that have come in, which are fantastic ones that are coming in. Jackie, can you just explain the main strands of nursing that someone might go into, please?
Yeah, so there are a number of branches of nursing. So you have your adult general nurse, or called an RGN, a registered general nurse. You have your paediatric nurse. There's midwifery as well, which sits slightly separately, but as Gemma's touched on, you have mental health, you have psychiatric nurses, like Gemma, mental health, and you have learning disability, like myself as well. So there's 4 main branches of nursing that you can enter into with a particular specialist. I guess the most well-known are often your general nurse, which you will see on the news a lot at the moment in the acute general hospitals, like with Joe. Paediatric nursing tends to be the most popular one at the moment, and I think less known is psychiatric nursing, and even less so is our learning disability nurses as well. But yeah, quite a wider range of nursing.
Yep. And then question for Jo. When does a nurse decide what they want to specialise in? So the branches that Jackie just described there, at what point do you know which one of those you want to go into?
I think now the way that the training has, because it's moved to a degree, you come in knowing which field of nursing that you wish to go into. So you already come in knowing that whether you want to be an adult nurse, a children's nurse, mental health or learning disability, or if you want to do direct entry to midwifery. So I think you kind of need to scope out. It's no longer kind of saying, I want to be a nurse. You need to be kind of coming prepared and saying what type of nurse that you want to be. And then that way, by looking through the internet sites like the Nursing Midwifery Council, or looking at Health Education England websites, or looking at the universities, then you can explore more about what the requirements are then for those fields of nursing. You may have somebody that's influenced you. You may have your mum may be a nurse, or your dad, or you may have been an aunt, or somebody that looked after you when you went in maybe as a child to maybe have some procedure done that maybe triggered something in you that made you to feel that you want to do something caring, that you've got some compassion, that you want to be like that person that you've seen, or you want to aspire to. And I think it's usually that's what you need to come to your interview, being prepared to know which field it is that you want to go into. I think once you've done that, in that preparation, you've already then scoped out what you need to be able to answer the questions and what you can bring to the role. But a lot of care, a lot of compassion, a lot of kindness, a lot of dedication, hard work. It's not like any other degree that you're going to go to because it is hands-on work. That when your friend is doing a geography degree or a history degree, they will be studying full-time. When you're doing nursing, you're on the wards, you're clinical, or you're in a community setting and you are working as part of that workforce. Although in a supernumerary capacity, you're doing long shifts.
Okay. May I just add to that? So sorry, with the different branches, and absolutely, and Jo said previously you used to be able to do, you did what was called a common foundation program, I think the first year, where you would do, all nurses would come together, then the second and third you would choose a specialism, and that's changed now, as Jo's pointed out. We do though, when you are qualified, so as Mental Health and Disability Trust, we have registered general nurses working with us, we have adult, children's nurses, and likewise, and so our learning disability nurses can work in mental health, vice versa, and in the acute general hospitals as well. So yes, you have your specialist skill set, but actually, when you're looking at the individual holistically, you're not just thinking of somebody with a mental ill health, but actually their physical health as well. So you can, venture into other worlds, which we can touch on later, but within the NHS, you can venture into other worlds of nursing, with a different, even if you have a different qualification.
Yeah. Okay. Well, Jo, I mean, you answered that question really concisely for me, or the question at least I was about to ask, which is the sorts of skills and qualities that you're looking for. But perhaps if I could just nail this down, Jackie, what are the qualifications? Does someone have to go to university and get a degree to have a career in nursing, or are there other entry routes into it?
So Jo will be far better qualified to respond to this than I, but I will start. I mean, yes, it is a university, and now it changed to a graduate profession. When I trained, it was in an institution. It was a school of nursing, and you came out as a registered nurse. But I subsequently then went to university for a degree and then a master's degree. But now it is a university. But there are different ways of entering before you even want to think about embarking on going to university. That we can talk about voluntary work and things, but there is what's called nursing associates now. There are different entry levels and different ways where you can then, if you imagine your nursing training is 2 years or 3 years, depending on whether it's master's or degree. Prior to that, you could do 2 years as a registered nurse associate first of all. You might want to stop there, or you might want to continue. So yes, it is university to be a general nurse, but there are different routes going into that first of all. Jo, if there's anything else you want to add, because it's more your bag than mine.
Yeah, I think that if I was talking to a 16-year-old me or an 18-year-old me now, or a mature student, and saying, we want you in nursing, and talking about do you want to come to university and get a 3-year direct entry route, or do you where you encounter the 50,000 debt that goes with that, okay, as which all your other colleagues would be encountering? Or would you want to come and do an apprenticeship style nursing or midwifery, which is what I did long time ago, where you get some salary support to do your role and so you work alongside your peers. I think that if you're making those decisions now, I think you need to be clear about what it is that you want, because I think that one thing that the environment has shown now is that the nursing is a career for a lifetime. It doesn't go out of date, you know, and we've seen a lot of nurses that have retired come back to help us and support in the workforce. So I think that I would be looking to see what options are, what suits my personality and what suits my ability, because if my ability and my strength is academic and work and strength to that, I think then you may be a direct entry student and you may want to do that and you may excel in that pathway. If you're more like that, you know that you can only provide some of that time, but you have to support a family, or you want to be have that apprenticeship style route, I think then that you need to be looking at apprenticeships. And as Jackie has alluded to, we have two ways to do that. We can either do that as an apprenticeship degree in nursing, or we can do an apprenticeship route where we offer a 2+, what's known as a 2+2 model, where you can be trained to be either an assistant practitioner or a nursing associate, and then go on to do a higher apprenticeship, which would then lead you to your Band 5 registered nurse. And I think that's what's the beauty about nursing now, again, is it feels for me like it's gone full circle, and I think that's what's a great opportunity for people coming out now of school.
Yeah, okay, no, thank you again for explaining that. And I think that really paints the picture very well. I mean, we know that for university entries, we would always refer people to the UCAS website, which is a whole wealth of knowledge. In terms of apprenticeship openings, though, and opportunities for there, where would any apprenticeships be posted, or how would someone find out about apprenticeships within nursing? Let me ask that one to Jo first of all.
Well, there's an apprenticeship website in Skills for Health, but also here in Hertfordshire, I think that we're very much now as employers, we have got an apprenticeship levy that we have to utilise to develop our workforce. And one of the things that we're doing as part of an integrated system is that we're looking to advertise how we can support apprenticeships within our organisations. We work very closely with our partner universities, which is the University of Herts, University of Beds or Anglia Ruskin. But we also need to link more now with the colleges, because again, as 16-year-olds, you're not necessarily all staying on to do A-levels. Some of you may have decided to go on and do college. So either to do the T's or like some other form of development where you can get the entry requirements that meets that. But again, it's about signposting you to those websites.
Okay, and I mean, let's just take it back a step before, because I really want to make sure we nail down on the qualifications you're looking for. Gemma, you spoke to us about the A-levels that you did. I mean, are there any particular A-levels or even GCSEs that you think people should really be working on, or really investigating if nursing is what they want to go into?
For me, I don't think it was essential which A-levels I did in order to become a nurse. I think I naturally I think it helped me to have done a psychology A level and a sociology AS level, so it definitely helped me to know about what I wanted to do from sort of having a bit of experience of that study already. I think that it would probably help you, but I don't think it's essential, and maybe someone else can answer that as well. But I do think that if you want to do more sort of paediatric and general nursing, I think probably would be ideal to have a bit of biology experience and knowledge behind you. But it's but I think that if you can gain that experience in practice as well, I think, and you can say that you've sought out experience after studying, then I think that would equally be helpful for you in applying to be a nurse as a degree.
Yeah, okay. Jackie, is there anything you'd add to that?
No, I mean, similarly, I mean, clearly maths and English, but I mean, similarly with A-levels, no, I also did psychology, and I did music, religious study and art as well. So very, very different. And that was because my mindset was at the time was going off to be a teacher in music. But no, I mean, the psychology definitely helped without a shadow. I had the personal interest, you know, I have an interest in that area anyway, and it helps working in learning disability and mental health. But no, I mean, and you know, the sciences, again, it helps to have a knowledge of that. But the maths and English, and Jo will be far better qualified than I to say about the entry requirements, but from an A-level perspective, no.
Yeah, no, I think that biology is still an important one of the sciences to have if you're going into, especially into adult, child, or midwifery. The maths and English, though, I would say to anybody, if you're doing anything, just concentrate on your maths and English. If you don't come out with having your maths and English, which was in the old GCSE level, which was a grade A to C, if you don't come out, I think it's 5 now, or maybe 4 to 5 or whatever, you just need to come out with that. If you don't get that, okay, and just remember, not everybody gets it the first time round, okay, all right, so don't feel that you give up on it if you don't get it the first time round. But the one thing I'd say to you, if you don't get it the first time round, is please go back and do that, because you will not get anywhere in nursing unless you have got that maths and English. All the experience, we can get you the experience, we can get you all the other things that you need, but I can't get you maths and English, and that does hinder our existing workforce because they can't get it. So I would say my appeal to all of you who will probably have an opportunity to see this webinar is, if you don't get your maths and English, please go back and do it. And if you don't get it a second time, still go back and do it again, get some help, and then go back and do it. Because once you've got those 2 subjects at those levels that you need, you will get anywhere in nursing and midwifery.
Yeah, okay, all right, that's a very strong message that you've given there. Just the last thing I want to ask in terms of core subjects, there's an increasing number of schools that are offering health and social care now, either as a GCSE or equivalent, or A-level or equivalent. Yeah. I mean, how much will a student learn about the life of a nurse, or through some of the things that a nurse would experience through those subjects? Joe, is it a course that you know much about or have been involved in?
I think the health and social care will give them a lot of knowledge around the aspects of care, the aspects of health, and get you familiar with some of the terminologies. I'm not necessarily as au fait with the T, which I believe the T's, which is replacing the BTEC, because I think that has got an inbuilt some clinical experience that you would be required to do, and I think that may be giving you more of an opportunity about a feel for it. I think often when you want to be a nurse, is about, you look at what's happening on screen and what's portrayed, but that isn't always the reality of what actually you are coming into. So I think that using the knowledge that you get from those programs, which are extremely important, because even in doing those programs, and I'll refer back to maths and English as well, maths and English can form part of those programs. If you haven't got it in the traditional routes, you can get your level 2 maths and English through those routes, that then you have the entry requirements. You meet the entry requirements then for nursing and midwifery.
Yep. Okay. All right. Well, we've got a whole barrage of questions that are coming now, so I really want to start asking these. So first one, I'm going to ask this one to you, Gemma. First of all, I'm interested in being a nurse, but I'm unsure what area I'd like to specialise in. Obviously, Joe mentioned earlier how important it is that you do know or have an idea of what you want to specialise in. Do you have any advice on choosing a field to specialise in? So how would you know which one you want to go into?
I think, first of all, you can a lot of them cross over, so you can always, nothing's finite. You can always, there is flexibility when you choose an avenue of nursing. There is flexibility to cross over into other disciplines, but I think in order to choose, you need to think about maybe a little bit further along down the line. Where do you want to be? What do you want? Who do you want to look after? If you can get any experience of looking after different areas in different areas of nursing, it might help you to understand what you're kind of getting into. So I knew that I really enjoyed, through working with people with mental health problems, I knew that I really was passionate about that. But I also quite liked the children's nursing aspect of it as well. So I liked working with young people with mental health problems. So I kind of had to think about, did I want to work as a children's nurse, or did I want to work as a mental health nurse? And I think at the time, I felt that being a mental health nurse, I could also work in a children's ward, not necessarily a physical ward, but a mental health ward. And I knew that I could cross over. And so I thought that would be a good plan for me, seeing as from my psychology background, I really enjoyed mental health. I think often the representation on TV isn't quite what you see. A lot of general nurses, and that will you can move around there, but even in general nursing, you're specialising often in respiratory, renal, cancer, so many different areas. So even within one discipline of nursing, you're going to specialise even within that. So just know that you can shift around wherever, and as long as you're open to sort of training and learning new skills, you can move around. Nothing is finite, but you do need to think. I think some don't cross over into the others. So mental health, you can't really work on a general ward because you just won't have the skills, but you can work with children, or you can work with learning disabilities. So you can sort of, you don't have to limit yourself as such, but you might need to think about, thinking about who you want to work with in the future.
Yeah. Okay. I've got a whole string of Gemma questions here, so we're focus is going to be very much on you for the next couple of minutes. So this question is for Gemma. Do you need to go to university to be a midwife, or are there any other routes to get you there? I mean, obviously Joe kind of answered that one earlier about nursing generally, but specific to midwifery?
Well, I literally, when I finished my first degree, I still didn't know what I wanted to do. And I went travelling for a year as well, just to see, what was out there, think about in my head. And I did think I would love to be a midwife. I really like babies. I really like sort of working with people, and I care about people. But then I kind of realised that actually midwifery was more about the mum, and it's more about the family, and that actually that was a lovely thing to work about as well. So I decided to sort of apply to be a midwife. I didn't. Well, sorry, what was the question? The first question.
The question was, do you need a degree to become a midwife? Have you got to go to university?
I didn't need a degree to apply to be a midwife. I only needed A levels. But you will get a degree after you finish your midwifery training. Does that answer your question? But I didn't need a degree in order to apply, no.
I'll probably add to that, if I may. Traditionally midwifery was that you went on and you did your adult nursing first, and then you went on and you did an 18-month midwifery program. That 18-month midwifery program is still available as a postgraduate, so you can do that. If you want to be a direct entry midwife, then you do need to then apply either to do it as a degree or as an apprenticeship, and then that way, because it is a degree entry program. So you have two options at the moment, which is the direct entry, where you do it as over 3 years, or 3.5 or 4 if it's over an apprenticeship route, or you do it where you do your adult nursing or your mental health nursing first, or your learning disabilities or your children's, and then you decide you want to be a midwife, and then you do an 18-month program, which is still available. And that's a postgraduate.
Thank you, Joe.
Joe, just thinking about the kind of, I'm going to call it the standard, it's probably the wrong word, the standard midwifery degree course over 3 years. Is that, I mean, how specialised is that in midwifery, or are you learning some general nursing skills and knowledge along the way with that one?
I think that it does incorporate some of the general, because you're looking after the mother, and the mother has got a lot of underlying conditions, but the focus is purely on the midwifery, because the requirements is that you fulfill the requirements for the Nursing Midwifery Council hours, which are midwifery, which is 4,600. So you have to do it all in midwifery placement. So you wouldn't have any adult placement or anything specific. And that's why it's a challenge, but lots of midwives love that direct entry route. But lots of midwives also like to do adult nursing or do another, and then have that 18-month. And I think that's the beauty about whichever field you go into, that isn't your bag for life. I think that's what the message is to get across. Nursing, you can change any field at any time. You can progress in any route, any speciality at any time, and you might think that you're going in one direction and you end up in another. And I think, Jackie alluded to that, having done general nursing, and then I went and did my midwifery. I thought I was going to stay in midwifery, and then I thought, I wanted to go out into the community and see what was happening out in the community. And then I came back into the acute sector in education. So I think that the message there is that even though you pick something, that isn't necessarily your choice for life.
Okay, thank you. That answers that one very well. A couple of questions to just talking about the experience of being a student nurse. So how do you get, or do you get to choose your placements, or are they picked for you? How prescriptive is it, Jo?
So the placements are we all for nursing, midwifery, and all of the disciplines, the partnership is about the degree that you're undertaking. So half of your program is with the university and half is with the placement provider. So for our students here at West Herts that would be coming here, we work closely with the placements team at the university to map out what placements that you need in year 1, year 2 and year 3, and that is subject to meet what the curriculum requirements are for you to have. So it might be that you need to have a medical ward, a surgical ward, a care of the elderly. Likewise, if you're in mental health, it'll be whatever scopes that are in that, and Jackie can explain that more. You know, it's whatever the areas that are needed for a year 1 student in a year 2 and then a final placement student. So it's very much meeting the requirements of the Nursing Midwifery Council, which is what senior hours must be, and the curriculum is built about what are those competencies and those standards, which says what you must do to achieve being a registered nurse. Because every student who goes through a degree program at whatever university, assuming they do the work, will come out with their degree. When you come out as a nurse, you come out with your degree, but you also come out as a registered practitioner so that you're able to register with the NMC. So your dual qualification, really. You've got your degree and you've got your professional qualification.
Okay.
And I can add to that though as well. When I was training, you weren't necessarily given much choice about where you went, though they did think about what experience you would need. So in mental health, they would choose an elderly placement, a young people's placement, a community placement, and an inpatient sort of adult acute placement. They would choose different ones so that you got a broad experience and you could work out where you liked best, really, what suited you. And I always liked the young people and family placement, so I always used to go begging at the placement office and ask, please, can I have this placement? Which didn't always work, but sometimes it did. But what you can do is you can really tailor your elective placement to where you want to be. So lots of my colleagues, they even went to different countries for like a month to get experience in. Lots of people went to Africa and they worked for a month on a ward in Kenya, places like that. I chose to go into London to a children's ward in London, but it was outside of the Hertfordshire, but it just meant that you could get experience wherever and bring it back to and share it with your peers. It was just really valuable, but also it gave you a lot more choice of where you could think about where you wanted to be.
Yeah.
And I think if I can add as well, and it's the same, you know, with Hertfordshire and in other areas as well, the beauty as well, to yes, you do have to meet the NMC requirements, as Jo's correctly pointed out, but actually, you know, you don't always, you might think, okay, I'm going to want to be a mental health nurse, for example. I don't know if I want to work in older age or community or in child and adolescent and things. And we do try, and as an organisation, a lot of organisations say, well, go and try that, go and spend some time there as well and test that out, because you don't know what you don't know. And at the end of your training, you know, the brilliance of the NHS, and we hear it all the time now, it's a fantastic body to work for. It really, really is there are jobs, you know, and what we will then say, we have trained you, you know, in whether it's in West Herts, in Hertfordshire or wherever, we've trained you on those years of your training. You have a job at the end of it as well, because we've assessed you on that journey throughout. So, you know, sometimes the anxiety, and you see it a lot as on the news this morning, I've got a degree and I've got no jobs and things. The beauty of the NHS and the nursing, there are jobs, you know, and because there's such a plethora of different opportunities that you can experience and do. So it's another brilliant bonus.
Yeah,
and if you want to be a children's nurse, because often, like, you know, people say, I love children, I love working with children. Again, it's known where you want to be with your children in your nursing career. Do you want to be at the front line in your ED where they're coming in with their various illnesses and emergencies, or do you want to be in a ward where they're recovering? Do you want to be in a specialist area? Do you want to be in the special care baby unit with the very little tiny tots as they're born? Or do you want to kind of be out in the community looking after them in the community? So again, it's thinking about, like, you know, whichever field that you decide that you want to go into, it's known that during those 3 years you have an opportunity to try out a lot of placements, a lot of different opportunities, and then you decide where you specialize in. And that can then be the platform to say, where is your next step in your career and what's the next stage? Because getting into nursing and completing your degree is just the first stage.
Yeah, it's a big learning experience from then until you retire. A couple of questions have come in just about the experience of being a student nurse. So I'm not sure how you'd measure this, but how intense is it to be a student nurse? And then sort of a follow-up question to that, through your education in degree and studying, how have you coped with balancing your work and social life? I mean, Joe, for what reasons might someone as a student nurse or someone brand new into nursing, what are the things that they're likely to find challenging or perhaps might be unprepared for?
I think it'll depend on whether you decide to stay at home or whether you decide to move away. If you decide to move away, then it's all the bits that goes with being in university, which is getting to know everybody, moving around, living away from home, that separation from your parents, living in accommodation which may be not quite the same accommodation or as comfortable as the accommodation you've just left. So it's all of those things, and you're getting part of the university experience, the freedom that goes with that, and probably a lot of jolliness that goes with that. If you're at home, it may be still managing to being part of degree, trying to form friendships that you can maintain, and that's where the beauty of the phones and internet and everything, so that you can do that, are still. When you go into university, then you form the curriculum, you start following the curriculum straight away, so you're already then geared up to what coursework you have to do when that coursework is due. Looking at your style of writing, so if you're good at English and you're at A-level standard, you may find that easy. If you're not so good at English, you may find that that's something that you're going to have to maybe work a little bit harder. If you're organized, that you know when the deadlines are, that you will put in the time so that you can plan when those assignments are due, so that you give yourself lots of reading time, lots of planning time, and then time to undertake it. Or if you're a kind of a last minute person, that you're up the last minute night before, burning the aisles just to get the assignments done. So it's a bit about that from an academic point of view. And that's probably what is appropriate for all and equivalent for all students. The difference then for you is then you come out on your placement. Now, when you come out on your placement, you are working. So you're starting your shift at 7:15. That's what a shift pattern is. And you don't finish that shift pattern until 7:15 that evening. So it's 11 and a half. You've been 12 hours on site or wherever you are. And during that 12 hours, you've got to get here and you've got to get home. So it's probably been about 13, 14 hours. And then you might have to do some reading to help towards that assignment. When you're on placement, you have to achieve all the competencies that are required for that placement. So you will have a mentor that will be allocated to you, that will work alongside you to show you what to do and then observe you doing it so that you can be signed off as competent to do that. And you have that all the way through your training in year 1, year 2 and year 3, because that's the component where practice gives you the 50% to say that you have passed that bit of it, okay? The academic and the essay is the university bit, which says that you've done the academic component of it. You need to pass both sections to get on the NMC register.
Right, okay.
I would just add to that and just say that I did a degree that's sort of not nursing. I did English and psychology degree, and then I did my nursing degree. They were completely different in that my psychology and English degree, I was in lectures about 10 hours a week, and that was it. And the rest was me studying and independent learning. Whereas nursing was more, when I was in practice, like Joe was saying, 37.5 hours a week. And when I was in university, I was in university most of the day, and then it was independent study. And I really did use every hour to study. But I have to say, even though it was a more intense course in that it took up a lot more of my time, and I have to say that I got a better grade because I loved it. So I think, and I can 100% say that I only got a better grade because I loved it. I think my first grade I didn't get so well because I was a bit not sure about it. But nursing, even though it was more labour intensive, I just enjoyed all of it. So yeah.
Okay. Yeah.
And I think that's good what Gemma said as well, because I think that not everybody does need to go in and do nursing directly. They could go off and do their degree in history, psychology, English, maths, and then decide they want to do it. And if you were to do your nursing as a postgrad, then it is a shortened program. You do it in the 2 years. So again, that's why the intensity that Gemma's alluding to of having to do that.
Yeah. Okay. No, thanks for that answer as well. That's very informative. And I think it gives everyone something to think about. Just whilst we're talking about university and courses, Jackie, you've referenced the courses that the University of Hertfordshire has to offer, and I think that's something that in Hertfordshire we're very proud of, courses there. Are there generally any universities that you'd want to direct people to have a look at?
I mean, I think from Hertfordshire, I mean, Joe also mentioned Anglican Ruskin and Bedfordshire University, and we also have Norwich and Norfolk because we have services up there. Hertfordshire, we're a university trust, and with West Herts, where a lot of our students will come from Hertfordshire, and it has got a good reputation for nursing without a shadow of a doubt. So I guess, yeah, from my personal opinion or professional opinion, I would suggest go and have a look there. I mean, please make sure we have our contact details are shared. Please contact any of us as well. But I think you'd get I'm sure you would agree, Joe and Gemma, but I think try with Hertfordshire first of all, and just with the programs that they offer and the resources that they have there on site would be a good first stop.
Okay, thank you. Right, some very specific questions. Sorry, come on, Joe.
I was just going to say that again, it's looking at where your field of speciality is, you know, that some areas may support more opportunities for your development. Where you've done a first degree, then you might want to do your second degree in the same place. So it's wherever you've chosen to do that as well. But yes, we are very supportive of our local universities, and the reason that we say that is because then you stay local and you're more likely to take up a position with us afterwards, you know, which is what we're very interested in.
Yeah, good. Okay. Right, some very specific questions now. Are there any books that you both recommend, or that all three of you recommend, based on nursing? Anything that someone could read that would really inspire them, or perhaps paints a really accurate picture of nursing?
Probably not so much a book at the moment, but I would really direct everybody to the Nightingale Challenge website, and we can share that details, because this year is the year of the nurse and midwife. It is celebrating the 200th anniversary of Florence Nightingale, the birth of Florence Nightingale. So I think that is a lovely website at the moment, which has got lots of information about how the global workforce of nursing and midwifery is working together to champion nursing and midwifery as a profession globally, and how we can influence the policymakers in some of that decision making that they do. So that is a really lovely website. Looking at the Florence Nightingale Foundation, again, looking at some of the quotes from Florence Nightingale are very inspiring at this moment, which would be very good to know about. And then the other site that I would probably direct you to, it would be to the Health Education England website, which has got some very useful information about on the different routes into nursing. And then finally, we've got our Nursing and Midwifery Council website. So all of those have lovely links into different informations, because a lot of the books will be very much around the coursework and about saying, I want to be a nurse and things. I think those, in just going through those fields and looking at some of those information and hearing some of those nurses talking about their careers is about really just maybe being inspired by one of them.
Yep. Okay.
I was actually looking as well the other day. I was just having a browse, but on YouTube there's some really interesting student nurse accounts of you know, their experiences in practice, and I was looking at the mental health ones, and they were really, you know, really positive and really loads of enthusiastic accounts of what it's really like. And I was pleasantly surprised that a lot of them were really positive, but they were really good ways to sort of just listen to what it was like just to have a real experience from a student nurse currently. So YouTube is actually okay.
Yeah, well, no, so there was another question about specifically about blogs and vlogs. So yes, use those as your resources as well. Jackie, are you able to describe more about the health visitor role in Hertfordshire?
That would
And
not
what
be
is a
for
health
me.
visitor?
So health visitor, Joe might be a bit better. So with health visitor, and they come to the community health trust. So it's not within mental health and learning disability. But Joe, do you want to speak a bit more about that?
Yeah, so again, health visiting, usually you come into do your specific field of nursing, and then you go on to do your health visiting. There is a direct route into health visiting now as well, but again, you may feel that what is it for you, because often you want to have both experiences. When I did health visiting, it was very much focused on the care of it was called cradle to grave care. Okay, so you looked after a lot of your 0 to 5s, but then you looked after your elderly at the other end of the scale. What you found is that the children took over because of the high caseloads and the high number of families that you were supporting because of the numbers of births. But it's a lovely role. It is supporting families. It continues on from as soon as the family know they're pregnant, and it's the family know they're pregnant, that you're involved in antenatal in that with supporting alongside the midwives. And then postnatal, when the midwife has discharged that care then comes under the health visitor. The health visitor will do a new birth visit and then give you access to all the clinics and the support services that are in the community to support you as a new family. And then they will also link you with your GP surgery on when the time is for that little baby to have all their immunizations and all their developmental checks as well. Those are all the niceties that go along with health visiting, and there are also some challenges within health visiting, because obviously there are families that are in need, be it that they have a child with learning difficulties, or be it that there are some what are safeguarding issues, and that are domestic violence issues that are having support, and that they're having to support that family because there are equally drug and alcohol or mental health issues. So then there's families, and that's where health visiting works very closely with the schools, community mental health teams in supporting that family, because the main aim in health visiting and in social care is to keep that family as a unit.
For sure. Okay. This one probably just a yes or no answer to this one. Any of you can jump in. If I were to study adult nursing at university, will I do a module on mental health?
Yes.
Yes.
Yep. Good. Okay. Is there anything I'm going to ask Gemma this one. Is there anything you wish you knew before becoming a nurse or studying for your nursing degree?
Wow. Probably, well, first of all, when I started my nursing, sort of looking into nursing, I didn't actually know mental health nursing actually existed as an avenue. So I learned that quite quickly, that you weren't just a general nurse, well, not just, but if you weren't, there wasn't only general nursing, there was all these different facets to nursing. I didn't even realise, and I think I didn't even realise that after I qualified as a mental health nurse, even after that there were 100 other facets that I could do. So it's all, I think even now I'm learning every day that it opens up, there's doors everywhere opening up. So not that I wish I knew, but I am always learning something new. And I think with nursing, I'm learning something new all the time from all the different students and the patients that I'm working with, that it's a continuous development. There's always innovative practices to learn. There's always new best practice to learn. You're never, if you never learn anything and you stay in this position when you first qualify, then you will very quickly be behind everybody else. So you've got to always keep thinking about what's the next thing that you can learn, which also keeps it really fresh, and it keeps it challenging, and it stretches you and gives you sort of, opportunities to take up new different practices, new different avenues. What I wish I knew, I think what I wish I knew is that shift work is hard. It is hard. Night shifts are hard, and I learned that I didn't always want to do that. and that's why I chose as well different parts of my career. I chose different parts because I didn't always enjoy the shift work. I didn't always want to work weekends as well. When all my friends and family were going out on a Friday, Saturday night, and I'm getting the bus and seeing them all driving past the pub, that was hard. I wish I'd known that was hard, but it doesn't. That's not forever. And you know, some people love that. I think I just wish that I knew that it wasn't always the easiest thing to do was night shifts. But like I said, you don't have to do them forever, and you don't have to do them at all. You just have to choose where you want to go.
Yeah, in fact, there was a question later on, Gemma, that came in about how do you juggle not only your work and sort of social life, but having a family and a young family as well. And I guess that you're perhaps far enough down the route in nursing that you could make those choices, could you, about trying to make patterns fit in with your home life?
Absolutely, and I think the thing is, I was very fortunate. So I have had during my 8 years in one of my jobs, I've had my 2 children, and I was fully supported during my pregnancies and my maternity leave, and after a flexible working when I wanted to adjust my hours to fit my childcare needs, to you know, to take a break from doing night shifts because it wasn't appropriate for me to do them when I had a baby at home. I was really supported through that, and I think nursing and the NHS is really good at looking after you know, people who want a work-life balance. Lots of my colleagues, they worked certain shifts so that they could do their own therapy, so that they could move on and be psychotherapists in the future, or they wanted to do courses like family therapy. They wanted to learn things like that, so they were supported and funded to do courses within their nursing role. So I think to find things that you're passionate about within nursing, often your organisation will support you in learning more about that. But finding a balance, I think it's just really about using your time and knowing what you want, you're planning your time, knowing what you want to do with your free time, and finding things that, you know, mean that you can relax, you can sort of have a bit of downtime and enjoy yourself. It's just really working out and requesting the days that you want off, making sure you can still go to all the events that you want to go to. You can organise yourself, and your colleagues will support you. I always was able to swap shifts and things. I think that's what's really great about nursing, is that everybody's in the same boat, and they always seem to look after each other and make sure, you know, look after each other and make sure you all have a work-life balance, in my experience.
Yeah, well, you know, you've solved that really well, and that sort of camaraderie and togetherness and rapport within your team. We're into our last 5 minutes here, so I want to get through these questions as quick as we can. So if you try and answer these perhaps as concisely as you can. Jo, how competitive is children's nursing? How do you make yourself stand out?
I think that's haven't read. It's very competitive. They have no trouble recruiting children's nurses. I think after this year we'll have no trouble recruiting any nurses because there's such an interest in the NHS. Yeah. But particularly children, there is a high demand, and there is. So therefore, what I would say is do some reading. Look at the sites that I've said. If you can draw on any experience or get some experience, then I would get that. If you were standing in front of me, it's what's your unique selling point? Why should I pick you in comparison to somebody else? So sell yourself, just sell yourself.
Yeah, brilliant. Jackie, if you can answer this one, how will I know, or how would someone know if they're able to deal with the mental toll of nursing? For example, having a patient pass away, which I'm sure is something that, you know, everybody has to face probably quite early on in their career as well.
Yeah, it's been a challenge, and I have to say the last few months of COVID-19 has been the biggest challenge of my nursing career. I've been in the NHS 30 years now, and I'm sure a lot of us. And I still remember the first time I saw somebody die, and it sticks with you. What I will say, and Gemma touched on it, the support you have around you within this whole NHS, but it is absolutely second to none. You know, the beauty, and particularly in COVID recently, us as a mental health trust, we offer that to our staff and support anyway, and also we've done it to our partner organisations because we've seen some real challenges as of late, but during our nursing career. So however think you're going to be prepared for it, it's tough. you know, but we keep saying you have so much support within the workforce, within your teams, within you whilst you're training within the university, and it's just making sure you build on those resources and that support around you, and it sticks with you. Of course it does. You'll see some pretty challenging things, but you see some fantastic things. You see some things you are immensely proud of and so pleased to be part of, and that definitely outweighs it.
Yeah, good. That's a really good way of framing it. Gemma, what differs between psychiatric nurses and psychotherapists working with families and children?
Well, I was always confused. What's a psychiatrist? What's a psychotherapist? What's a psychiatric nurse? I was always confused. So a psychiatric doctor is a doctor specialising in mental health, psychiatric disorders. So they can they deal with the medical side of the mental health. Then you have psychotherapists. They are people that offer therapeutic free spaces in order to think through, listen to people's worries, concerns, work through any issues that person has. They offer a free space. Psychologists, they offer a very structured approach to thinking through things. They offer therapies such as CBT and very ordered approaches to psychological therapies. And psychiatric nurses are the nurses. They're not often on the ground. They're often just looking after you on a day-to-day basis, but they're thinking very psychologically about your needs. They keep in mind all of your needs, but they're mainly thinking about your mental health and what they can do. It might often just be a conversation, might often be engaging you in the society, might often be giving you the validation and the reassurance that you need on a day-to-day basis in order to feel better, in order to recover. But those nurses are often there on a day-to-day basis just to think through things in a less structured way, but in a day-to-day way. Does that answer that? Because there are so many different wordings that I was confused when I first started.
Yeah, no, okay. I mean, where would you suggest someone goes to just to find out and try and get some clarity on these sorts of definitions?
I asked the people that I worked with, which went down a treat because they were like, well, I'm glad you asked me. They always get asked, psychologists, psychotherapists, psychiatric doctors, they always get asked because they all sound so similar. But I think you could, if you don't mind Googling it, you'll get a very good dictionary definition of what they are. But in order to find out, you can just ask. You can always ring up places and just ask to speak to somebody to just get a little bit of insight. And often people are really happy to talk about their own experiences and to talk about their jobs because they're passionate about them. So yeah, it's often, you know, just ask and people would often tell you.
Yeah, okay, right.
But it's good that you asked here as well.
Final couple of questions. I'm worried we've just gone past 4:30 now. Jackie, if you have a disability yourself, can you still work in the nursing sector?
Absolutely. Absolutely, yes. I mean, it's what we ask for in nursing is to be caring, compassionate. We have trust values about being positive, kind, welcoming, professional, respectful. Disability is you know, absolutely. We will work around and to meet your needs because you have a unique gift that you will give to us, and that's irrelevant to the so definitely no problem at all.
Brilliant. And the final question I'm going to ask, there's a few questions that have come in around gaining work experience. What's the policy on work experience kind of at the moment, and what would it be in non-COVID situations?
So if I touch first, and it's a bit different for Joe in the acute. So in mental health, we adults are 18, and in the acute sector in the hospitals it's 16. So we are restricted in some way. We have had a work experience. Both my sons have come and to work experience, but we'll be restricted at the moment in mental health where you can go for your own, you know, for your own interests as well as those of our service users. We need to respect the privacy and dignity of our service users. But there's lots of shadowing opportunities, and I would just urge you, as Gemma said, just contact us and ask, because you don't know what you don't know, and we can certainly, you know, look at opportunities for you to give you a flavour. Joe, it's probably a bit different for you, isn't it, in the hospitals?
Yeah, I think we're very guided by the contracts, and obviously because of the age of where you can work. But if it's just about getting a feel of what a hospital environment is like, then we can arrange for you to touch base with other services. And I think it's really just it's shown that expression of interest if you haven't done it as well. There's lots of things as well that you can look at and see if if you don't want to go off and do your degree first, like when you finish school, is maybe just coming in and working 6 months as a healthcare support worker or a year, so that you can get that feel of going around and seeing what the pattern is like. Everybody takes a gap year out to go traveling. Well, maybe take a gap year out to come into the NHS and seize it for you and see what you can get from it. It's about looking at that as well. And I'm just mindful that that the audience, like, I don't know the audience that we're talking to, in the sense of, like, are you male, female predominantly? Are you white Caucasian? Are you from a BAME minority group? And I think it's just recognizing that nursing is very diverse. It's not gender specific. So there's everything that we're saying to you, we're saying to any groups out there. So because I think that we are very mindful that we have got low numbers of men entering the profession. So if there are any of you young men in the audience are thinking of a career, then please do look at nursing as one of your options.
Okay, just to wrap up, I'm going to ask you all just to sort of give a bit of a closing statement. Gemma, if I could ask you just to start. By the way, as I'm asked, as Gemma, Jackie and Joe just closed it, I'm going to put 2 polls up on the screen here, which are for you in attendance, just to give us your feedback on the session. I really do apologise we've not been able to answer all your questions directly, but hopefully we've covered most of the areas. But Gemma, if you could just start with us by telling people, why should they want to go into nursing?
I think for me, if you want to make a difference to people's lives, if you want to improve people's lives, I think nursing is the avenue for you. I think you will always make a difference if you are passionate and curious and caring and kind to people. I think people just need to feel that often in order to feel that things are worth getting better for, and to give them that hope. So I definitely think if you are passionate about making a difference to people's lives, and if that in turn gives you a sense of fulfillment, I think that would be a great basis for being a nurse.
Thank you. And then Joe, could you just kind of summarise for you, what are the things people should be considering when they're trying to choose which specialism they want to go into?
I think it's looking to see what's been your influencing factor that's made you even look at nursing. Has it been some aspect of care? Has it been somebody that was involved in nursing in your family? Was it somebody that, as I said, that looked after you? Just seeing which field that is. Thinking about where you want to be. Is it like, do you want to work with children? Do you want to work with mental health? Do you want to work with learning disabilities or adults? I think it's just seeing what have been the influences that's first put it in your mind, even in your mindset, to say why it is I want to be a nurse. If it's been something like Holby City has been the influence, then probably you need to think a bit wider than that, because that isn't nursing. That's the glamorous version. I think it's just looking to see what have been your influences, talking to people, talking to your careers advisors in the schools, because they will have people that can have able to direct you in some framework to other people, linking in with the trusts that you're working with, your schools are working with, or your colleges are working with as well. I'm happy to talk to anybody about nursing, really. So and I think because I've covered every field, I feel I can do that except mental health. But even then I did 8 weeks of mental health in my training.
Yeah, thank you. And then finally, Jackie, and I'm going to put another poll up as you're answering this. What's likely to be the future demand in Hertfordshire for nursing?
There's always a need for nursing, absolutely, and definitely. I mean, Joe mentioned it earlier that the interest in the NHS has gone up massively, which is fantastic. But we have a number of nurses in Hertfordshire, in particular, who are due to retire soon. So we have an ageing work. We've got quite a diverse workforce. We do have a number of staff who are looking to retire, and we're always recruiting. there are plentiful opportunities for recruitment into the future as well. Be it for you guys, you know, in 5 years' time when you qualify, there are jobs out there. And as we've all touched already, the diversity of nursing, the opportunities. Don't just think, you know, don't just think it's blinkered and in silo. There are so many opportunities anyway. But yes, most definitely future jobs.
Okay, thank you very much for those answers. The poll results, which I can see, I appreciate everyone got, seem to indicate that everyone feels very inspired by the session they've just been part of and the answers that you've given them, and that they feel better informed as well. So I think our three panelists today, Jackie, Gemma and Joe, have been absolutely fantastic, and they've given you hopefully lots of inspiration, lots of really, really good information. So firstly, thank you to all of you in attendance who have contributed this one, have been submitting your questions, and I really do apologise I've not been able to ask all of those directly, but hopefully we've covered most of those as themes. And then finally, let me just thank Jackie, to Gemma and Joe specifically for giving up their time to come and join us this afternoon and to share their passions around nursing. This session will be available to observe on our platform, which is HOP. So please do go and have a look at our site, whether it's nursing you want to find out about or any other career, or you want to find out about what the jobs market looks like in Hertfordshire. Hop into is the website. You can see some of our social media platforms there. That QR code, if you would take a picture of that now with your phones, that will automatically take you to our live webinar sessions. We've previously run related ones on a junior doctor and a physiotherapist within the medical field, but we've covered lots of different careers as well. So do have a look at it, and please do share it with some of your friends and with your family as well who may be interested. So finally for me, thanks again for coming in and tuning in and listening today. We really do hope you found it informative and inspiring, and we look forward to hearing how you're getting on and to finding out about your next step in your careers, hopefully for many of you that will be in nursing and will serve the community in Hertfordshire and the country for many years to come. Thank you.